Hello, so today I'm going to talk about small for date babies. So this is something that I have actually seen quite often in my clinic. So, if you've got a baby that's measuring small for dates, obviously, you will be under a lot more supervision and monitoring as is right and proper. And, you may also feel that you are being offered an induction at maybe 37 or 38 weeks. So this can be something that can be quite serious. So if I would really follow your medical advice, the Western medical advice that you've been given by your consultant, because the reason that they would like you to deliver more early is because basically you can look after that baby and feed that baby and love that baby and help that baby to grow when they are safely delivered and on the outside. However, acupuncture can be a great support at this time. It's obviously something that can make people feel slightly anxious. So maybe you've just got a small for date baby and you don't know why, or maybe you have a pre-existing medical condition yourself which has sort of facilitated this scenario with the baby. But whatever's happening for you, acupuncture can help you to nourish you, to support you, can treat the emotional and the sort of spiritual side of any kind of anxiety or worries that you may be feeling, and we can also kind of support you to sort of nourish the baby from inside up to the point where you're probably going to be induced. So we can do moxa, which is incredibly nourishing and can encourage babies to grow, and we would also spend a lot of time talking to you about diet and lifestyle. So I really emphasize, if I've got a woman who's got a small for date baby, you really need to eat qi nourishing foods. So from Chinese medicine aspect, that is foods that are warm, that are cooked, that are blood nourishing, and I would talk to you in a lot more detail about the sort of foods you should be eating. You should also be resting as much as possible. Light exercise is great, but if you're still working full time, you really need to try and make some adjustments to your working life. Think about taking your maternity leave much earlier, because you probably are going to be induced at maybe 37 or 38 weeks. So you want to really bring that maternity leave forward. So that's one less thing to be worrying about. And you want to try, and make some other adjustments, like maybe you can work from home one day a week so you don't have to commute. Maybe you could have a shorter working day, but really you just want to stop earlier. And when you are at home, please, you really need to rest as much as possible. Don't be trying to do things or see people. Just be resting and looking after yourself as much as possible to support your health and that of your baby.